Where the book bag at? Okay, then what you calling for then?
Good evening, everyone. Good evening. Welcome to this month's special edition of the Ask Mary and Pat Show featuring Miss Mary Finner, Miss Pat Foger. Tonight we have a special edition along with we have a few guests with us tonight. Unfortunately, Miss Mary Finner could not be here tonight, but we are in more capable hands with Miss Pat Bogle, as well as her few special guests. My name is Thomas Robertson, but everyone just calls me Duke. I am the Technology and Metrics Director for Oak Hill Regional Community Development Corporation, which is the parent corporation of Healthy Kids Mississippi. We recognize our board chair, Jennifer Garrett, our executive director, Dr. Michael O'Miner, and our project director, Mrs. Lottie Miner. In addition to this Zoomcast, we're restreaming this evening's webinar on our Oak Hill Regional CDC and Healthy Kids Mississippi Facebook pages. So please feel free to like and to share on your social media pages. Also, feel free to post questions or comments in the Zoom chat or in the social media comments. We will do our best to respond to each question. So tonight, I want everybody to drop their location. What part of Mississippi are you in that you're viewing this webinar from? We would love to hear the feedback. But without prolonging any more time, I'm going to turn it over to the star of the show, Miss Pat Bogle, and she will introduce her special guest on tonight. Miss Pat Bogle, you can take it away.
Good evening. Good evening. We are delighted to join each of you this evening for this week's edition, this month's edition of Ask Mary and Pat. And of course, we already have quite a few questions that have been submitted to us. And if you have a question, do not hesitate to ask, because I have several people on tonight that have my back. And without further ado, I will go ahead, since we already have quite a few questions submitted, and one of which is, what should I be? Well, first of all, I need to let you know who the special guests are that have my back, and they are May Stigler. She is an assistant and applications administrator. We have Sister Bettina Campbell. She's a social services worker with Oak Hill. We have Sister Doretha Knox. She is also an assistant and applications administrator. And I see we have Brother Clarence Campbell. He is an assistant navigator with Oak Hill. So we definitely have things going tonight, and we do have some assistance, and we appreciate that so much. Our first question: what should I be doing now to prepare for the end of the public health emergency? And of course, the answer to that question is you should be checking your mail closely for correspondence from the Division of Medicaid, for any updates on the end of your Medicaid chip. If you have a child that has already turned 19 and is presently on the COVID-19 Medicaid, you should also contact the Medicaid office if you have changed your address, phone number, or email address, in case Medicaid sends your correspondence at the end of the public health emergency, and you may possibly receive your closure letter of your family's Medicaid, or you have maybe even missed correspondence sent to you. So again, make sure that you contact your Medicaid office if you have moved, if you've changed your phone number or your email address, so they can keep all of this information updated. Okay? And at this time, Sister Stigler, she's going to ask a question.
Okay, along with what Sister Boga just stated, you need to make sure that you're corresponding with your Medicaid office. Make sure they have the correct address. Make sure they have the correct phone number, because you don't want to be off Medicaid and not know that you're off until you get to the doctor office.
Yes.
So it's very, very important that you correspond with your Medicaid office and let them know if you had any change in address, phone number, any information like that. I have a question. The question is, what benefit is for me to have a Medicaid assistant complete my Medicaid application with me? The benefit is you may not be able to get your representative at the Medicaid office to complete your new application or renew your application, or you may run into a problem with completing the application online or even the paper application. Review any information that you receive from the Medicaid office, and the Medicaid assistant, we would be more than happy to answer any question that you might have, help you complete the application online. If you need us to take your application to the Medicaid office, we'd be more than happy to do that.
Right.
We are here to help you. All you got to do is just reach out to us.
Yeah.
Also, if they complete their application online, it's going to go to Jackson first, and it's going to be much longer before they can hear anything. Once it goes to Jackson, then it will be dispersed to the local office. So, if you can get to a Medicaid assistant and get them to complete your application and take it and get it into the local office, your application stands a chance of being processed faster.
Right. Thank you so much. Okay, well, we have another question. I was approved for Medicaid for my children, but my sister was approved for CHIP for her children. I would much rather have CHIP for my children because it covers more services, and my sister is able to receive, her children are able to receive orthodontic services for her children who need braces. Why can't I get CHIP? Now, that is a common question. We hear it all the time. And the answer is Medicaid and CHIP eligibility is determined by several factors, and one of which is income, according to the MAGI scale, and the other is number of members in the applying family. If your sister's family income is higher than yours, according to the MAGI, and she may even have a lower number of members, of family members. And of course, that is basically how your eligibility is determined, whether it's Medicaid or CHIP. Okay. So, Sister Knox, do you have anything on that?
Right now, Medicaid stops at 18. CHIPs go to, so that might be the case in some cases, determining their age. CHIP will go all the way to 19, but
Yes.
Medicaid 18. So you can transfer from Medicaid to CHIP to another program. If you're 18 and you're still eligible in the CHIP program, you can go over to the CHIP program during your 18th birthday. You go to CHIP and stay there until you're 19 years old.
Exactly. Sister Stigler?
I think y'all did an excellent job on answering that question. I think we're going to a commercial break right now.
Okay.
Are we going?
Okay, if not, we'll go ahead and do another question and then we'll go to the break.
Okay. You want me to ask the question that I have?
Yes.
A client say, I am an immigrant and I need to apply for Medicaid for my children. I just moved to the United States about a year ago, and I do not have the proper documents to get Medicaid for myself. Although my child was born 2 months ago in the United States, can I apply for Medicaid? The answer is yes. Anyone can apply for Medicaid. If there's questions about whether you approve or going to be approved or not, you still can apply for Medicaid. And with the child being born in the United States, the child would be eligible for Medicaid because now she's a resident of the United States, and she will have to provide birth certificate and Social Security number. Any other comments on that question?
Then the parent may not be eligible because she don't have documentation of her
That's
citizen.
true.
Doesn't have a card, and neither has she been here 5 years. So she might not, but she still needs to apply.
Correct. She still need to apply.
Okay, and she may possibly be eligible for emergency services just in case she's not approved, right?
That's correct. She might be eligible for emergency service, and that emergency service would just be for the delivery.
Yes. Okay. All right. I don't have time to complete a Medicaid application for my children because I work 12 hours a day and sometimes more, 5 days a week. I am off work on Saturdays, but the Medicaid office is closed on Saturdays. So how can I apply? Okay, and the answer to that question is very simple. A Medicaid assister with Healthy Kids Mississippi can assist you with applying for Medicaid after Medicaid office hours and also 7 days a week. And we are available also 365 days a year. The assister will need your consent to receive your private information, your PII, and to complete the application with you over the phone or in person. The application is submitted to Medicaid, and normally within 30 days of receipt, you should receive approval or denial notice from the Medicaid office. Shortly after that, you will receive Medicaid cards for your children. And again, the assister is also available to answer any questions you might have. So we are, well, I would say we do have, I'd say we're around the clock. So we're available. And who would they need to contact to reach out to one of their sisters, Sister Stigler or Sister Knox?
All right. Was somebody else saying something?
Go ahead, Sister Knox.
All I was saying is they would need to contact the office, the main office, and they would tell them what area. They let them know which area you're from, and then they would give you the number of the assister that can assist you at that time.
Okay, thank you. Okay, and now we will take a commercial break and we'll be right back. And again, if you have any questions, you may add them in the chat or the Q&A if you're on the webinar, and if you're on Facebook, just put them in the space for what's on your mind. And of course, we will do our best to answer your questions.
There are Mississippians applying for health insurance that may not qualify for a program. However, we all know it is important for families to have health insurance. This is why Healthy Kids Mississippi has been working with our state's federally qualified community health centers, or FQCHC, to help our fellow citizens find a medical home. Our organization is focused on raising public awareness about health coverage options for children and their parents through the Medicaid and Children's Health Insurance Program, or CHIP, in the state of Mississippi. Our process is simple. Our organization's assisters seek out Mississippians. Once our assisters gather the necessary information from the consumer, they apply for insurance programs on behalf of them when consent is given. When the application process is complete, the applicant will find out by mail if their application has been approved. We want to help as many families in Mississippi as we can. To learn more about our organization, please visit us on our website, healthykidsms.org, or give us a call at 662-298-3584. We welcome you.
All right, we thank you, Duke, and we do want to invite anyone now, even though we're already in the midst of the Ask Mary and Pat. It's not too late to share. So if you're on Facebook, please share this with your friends, your family members, so they can join us. They might have questions as well. Okay, and of course, we do want to remind you that our next Ask Mary and Pat will be on October the 24th, not October 31st. So we want you to join us. Again, this program is held each month, 6:00 p.m. It's normally the fourth Monday of each month, but it's going to be on October the 24th. Okay, we have some more questions.
I received a question. It say, I recently applied for Medicaid for my child, and I was denied because I did not turn in my check stub in time for the month. That was the request that the Medicaid office made to me by mail. Now I have those check stubs, and I'm able to drop them off at the Medicaid office. Can I reapply for Medicaid? Yes, you can reapply for Medicaid. If you get denied one day, you can apply the next day. And you are required to have your check stubs. And it's for the previous month. If you apply and say this is September and you apply for Medicaid in September, you will need your check stub for the month of August.
Yes.
And just try to make sure you get them in within that time frame. But if for some reason you don't get them in, you can reapply and have your check stubs with you at the same time. And we'll be more than happy to let you be able to help you with your application. And you can always reach us if you don't reach us personally, you can always call the office. That number is 662-298-3584. And all you have to do is just let them know what area you live in. They will contact the correct person for your assistance, for you to get as much help as you need completing your application. And everybody will be more than happy to help you with that application.
Yes.
Any questions or anything on that?
Sister Knox, do you have anything to add to that one?
Oh, very good answer. That's why it's so important that you read your mail. Read your mail and read your mail and try to answer your mail. Because a lot of times, we throw mail aside and we forget about it.
That's true. That's true.
We are denied. It's too, we turn around and reapply, but then you could have had coverage for that time,
Right.
So it's so important that you read your mail.
Yes. And yes. And do your best to get those check stubs. Often we run into consumers that, we complete an application and we tell them they need their check stubs for the previous month. And sometimes they say, well, I lost them, or I can pull them up online, but I can't print them. But if you can just get them to us, even if you can email them, if you email them into Medicaid or email them to us, and we have your consent. So we already have your consent in advance. So, we are obligated to keep your information confidential so we can get those check stubs turned in. We are here to assist you. Okay, here's another question. My son is 21 and needs help. He needs health insurance. He is in college and he plays basketball and football. He needs coverage because of the risk of being injured while playing these sports. And I was told by Medicaid that he cannot receive Medicaid because he is over the age limit of 19. What do I do now? Okay. And the answer to that question is you can apply for affordable health care insurance for your son through Get Covered Mississippi. This is another entity of Oak Hill Regional Community Development Corporation, a nonprofit organization that assists individuals with obtaining health insurance. And a sister can be reached. We've given you that number. I'll give it to you again. All you have to do is call 662-298-3584. And we are available to assist you with that. So we not only help with Medicaid and CHIP, we can also help with affordable health care insurance. Our objective and our goal is to get you covered.
Good. Also, Miss Pat, then if their parent is employed and have health insurance,
Yes.
that they can stay on their health insurance until they're 26 years old.
Right.
We can also inform them that please check with your parents, make sure that they have health insurance and they can keep you on there until you're 26. If not, you just apply to Marketplace.
That's right.
That is right. That's good. And you might also, if they play in college football and basketball, might want to check with your college. They might offer some health insurance. But like Sister Bogan, Sister Knox just said, you can stay on your parents' insurance to the age of 26.
Okay. Do we have another question?
I just received one.
Okay.
I just recently got approved through Medicaid for CHIP, covering my daughter. Do I have to pay for CHIP? No, you do not have to pay for CHIP insurance, but you might have to pay a small copay once you go to the doctor. But that amount is usually so small to you probably have that already in your hand, so you can just pay that small amount.
Yes. Okay.
Any other comments, ladies?
That's it. It's very small copay. So again, you I'm sure you won't have a problem with that because it's a very small copay. Okay. Here's a question. I'm so confused. My twins will be over the age 18 in a couple of months. We receive family Medicaid because my income is very low. I was told that my Medicaid will end and they can continue theirs until they turn 19 years of age. Is this true? And if it is true, what will I have to do now? Or what will I have to do after mine has closed? Okay, and the answer to that question, this is true. You won't be able to receive Medicaid any longer unless you are pregnant and apply for pregnancy Medicaid, or unless the public health emergency is extended again. You may not be eligible for affordable health care insurance because of your income, but you can be referred to a federally qualified community health center for assistance with medical services. And of course, we have Mrs. Bettina Campbell on the call with us, and we would like to ask her if she would assist us by providing a little more information on that.
Good evening, everyone.
Good
Well,
evening.
of course, if you are not able to apply to qualify for Medicaid or CHIP or the Affordable Care Act, then you maybe go to one of the federally I guess it's 275 federally qualified health centers in the state of Mississippi. And they provide primary and preventive care, as well as substance abuse and mental health and oral care. And they provide it on a sliding fee scale, and they provide it regardless of your ability to pay or your health status. And also, if you have insurance, it's also a good primary medical home to have. So
Okay. So if they will they have to go to one in their area?
Well, for convenience for them, I think that I would choose one in my area. However, they are located throughout the state of Mississippi. And so there may be another one over in another county that they might prefer to go to. That's entirely up to them.
Okay. And what kind of assistance can they get with their prescription drugs?
Well, they also have a prescription drug program that they might be able to help with. It depends again on their income. Now, aside from the federally qualified health center, many of the pharmaceutical companies have indigent health programs. And so if you find yourself in a situation where you need to qualify to go to a qualified community health center and you're not sure, or you need help with your drugs, even if it's not a qualified health center, then just call the office and they will give you my contact information. And then I will work with you to try to see how we can get you qualified for a program. Because even many of the pharmaceutical companies around here, or the pharmacies around here, also have drug programs.
Okay.
So just give us a call and see if we can help you get the help that you need. Please, for goodness sakes, don't go without your medication because you think that no one can help. And if it's a choice between food and medication, get your food, call us so that we can help you get your medication.
That's right. That's great. We thank you so much. Okay. And I know that is probably a time where now there's so many, they are, because of the public health emergency, I've spoken with a possible consumer, but she ended up calling me back and letting me know that her Medicaid was extended because of the public health emergency. So this has been very good for them right now. But, with the COVID numbers going up and down and up and down, we don't know how long the public health emergency will last. But in the meantime, I just want to encourage consumers to make sure that you go and take care of your preventative services. And even if you need your eyes checked, don't sit around and wait on that. Go ahead and get that taken care of now, because the public health emergency could end basically at any time. It's been extended through October, and we're understanding that it may go up until the first of the year, but we don't know what will happen after the first of the year.
And Pat, I want to assure them that if they do go to a federally qualified health center, the care that they get is going to be just as good if they go to a private physician.
Yeah.
Because these doctors are just trained just as well as those doctors are, and certified by the state. So please understand that you will be receiving quality health care.
Thank you, Sister Bettina. Okay, at this time, we're going to take another commercial break, and we will be right back.
Congratulations! You have successfully selected and enrolled in a marketplace plan. Choosing the right health plan can be overwhelming, but it is important for you to know that the next steps are just as critical as selecting the actual plan. This is why we created this video, to guide you through on how to get the most out of your health insurance coverage. When open enrollment ends, the period known as From Coverage to Care begins. It is an initiative championed by the Centers for Medicare and Medicaid Services, or CMS, to help consumers with new health care coverage understand their benefits and connect to primary care and the preventative services that are right for them so they can live long and healthy lives. Ask yourself questions like, is there a time when I thought I should go to the doctor but didn't? Was it because of the cost? Was I afraid of finding a problem and how much it would cost if I did? Well, finding out early is better for your health and your pockets. Having health coverage relieves the stress of finding and affording healthcare services when you are sick. It is important to familiarize yourself with common health insurance terms. Terms like premiums, co-payment, deductible, and others. This will help you understand the differences between health coverages. After you understand the terms, it is a good time to learn about the different financial assistance options that are available for you, like premium tax credits and cost-sharing reductions. Once you have a basic understanding of health coverage terms and options, it is important to log into your account with your new health insurer provider so that you are able to pay your monthly premium. In your account, you will also be able to view your policy benefits, activity and usage, your ID cards, and also the ability to participate in telehealth. It's important to know where to go for care. Find a DR before going to the ER. By logging into your account and searching for providers in your network, you will eliminate the hassle of going to an ER. Finding the right provider for you is essential in maintaining good overall health. You may want to visit a few offices to make sure you and your primary care provider are well suited. Be prepared for the visit by bringing ID cards, records of your key information, including medical conditions, dates of past surgeries, current medications, doctors' names and contact information, next of kin and contact information, and any drug allergies. During your visit, it is important to be open with your doctor. Asking questions is key to good communication with your doctor. If you don't ask questions, he or she may assume you already know the answer or that you don't want more information. Don't wait for the doctor to raise a specific question or subject. He or she may not know it's important to you. Be proactive. Ask questions when you don't know the meaning of a word, like aneurysm, hypertension, or infarct, or when instructions aren't clear. For example, does taking medicine with food mean before, during, or after a meal? Now that you have a general idea, it is important to remember to make sure you pay the monthly premium and also continue to make appointments and fill prescriptions. Here at Get Covered Mississippi, we are always ready to assist you. Please give us a call at 662-298-3584 or text us at 662-689-9712. Email us at info@getcoveredms.org or visit our website at www.getcoveredms.org.
All right. Okay, I believe we have another question. I'm going to go ahead and, I basically answered it already. Does anyone know when the public health emergency will end? And of course, again, we do not know exactly when it might end. Of course, we just recently heard that it was going to be extended through October, next month, and then it may possibly go on through the first of the year. But we do not know if it will be extended after that time. So we just want you to be prepared in case it does end. Now, you will be allowed at least, I believe it's 60 days, to go ahead and make preparations to either get your Medicaid renewed, or you will have time to go ahead and contact us if you need assistance with affordable healthcare insurance. So, Mr. Campbell, I know you're one of our guests tonight, but do you have any more information on that you could share with us? The public health emergency and the possibility of it ending anytime after the first of the year, and what the consumer would need to do if it does. Okay, Mr. Campbell's not able to get on at this time, but we do want you to be prepared. Our open enrollment. Oh, there he is.
I'm sorry, I was between the kitchen and my den when you asked me the question. Could you repeat that for me, please?
Okay, now there's a question as far as do we know when the public health emergency will end? And of course, it's been extended several times. We do not know when it will end, but can you just kind of give them a little more information on it and what they would need to do when it does end, prepare them for, what's next?
Okay, so when a public health emergency ends, we're going to receive a notification from CMS regarding the ending of the public health emergency. And at that point, there's going to be a 60-day window for people, window for special enrollment people, for people to be able to apply for coverage through the Affordable Care Act. And of course, in order to obtain coverage through the Affordable Care Act, they're going to have to meet the conditions that qualify them, the income limits, if you're a married couple and you're going to apply for and receive advanced premium tax credits, you're going to have to file a joint tax return. And I guess that would be the biggest thing right there. And again, as Sister Knox had indicated, make sure that you watch your mail so that you know that this emergency is ending, that we're in the wind down period, and that you're going to be leaving Medicaid, and then you're going to have to seek other coverage.
Right. Well, thank you so much. Okay, Sister Stigler, do we have another question?
I don't have any more questions at this time, Sister Boga.
Okay. Let me see. Okay, here's a question. How long is the application process? If I'm interested in applying for Medicaid for my children, how long will this process take? Neither of you answer this?
Now, it depends, Ms. Bogan,
Yes.
it depends on the applicants. The application can be approved immediately if you have all the verified information needed. So if you apply today, it can be approved tomorrow if you send in all the information that's required. Now, if you do not submit all your application, all your information, they can the application can be held up to 60 days.
Mm-hmm.
What determines the length of approval is you.
Right.
So, patient.
That's right. So again, we just encourage everyone that is applying for Medicaid to just try to get your information in as soon as possible. And we know that sometimes it may be difficult, getting now if you're a new applicant, most of us, we have our social security cards in a secret place. So if you don't memorize your number, just make sure that you get that information in as soon as possible, as well as your check stubs. And sometimes you may have to get a letter from your employer or get them to print something out, but just know your eligibility determination will depend on this and how soon you get that information in. And there's normally, I believe it's a 30-day process, but they can hold that application up. As Sister Knox said, up to about 60 days, but try to get it in as soon as possible because they'll go ahead and close your case.
Ms. Boger, that's why I say it's so important that you go through the assistance
Yes.
because the Medicaid knows exactly what you need. And they can tell you right then and there, you need so-and-so, you need this information before your application can be approved. Can you get me this information so I can submit it to the Medicaid office? And this would cut down on time and you getting a letter and you mailing it back and going back and forth. So the assistants would know exactly what you need.
Okay, and there's a question, how long is the waiting period after I've been denied? And as Sister Stigler mentioned earlier, there is no waiting period. You can go ahead and reapply the very next day. But when you reapply, make sure that you have that information ready, because again, if you apply in September, you will need August check stubs. If you wait until October, of course, you're going to need September check stubs. And you can't turn in just one. If you get paid 4 times a month, if you get paid weekly, you have to turn in to Medicaid all 4 check stubs. If you get paid twice a month, it's 2 check stubs, okay? And again, we just encourage you to make sure that you get all of your applying information in, get all of your information in so you can go ahead and get your eligibility determination, because you need this health coverage. And if you qualify, you need this coverage. Okay. Will I be able to talk to my Medicaid worker? Okay, now sometimes, we are here for you. And again, we will keep your information confidential, and we are legitimate, as they would say. But if there's something that, a particular question that you want to ask your Medicaid worker personally, you can just give them a call. You can call your office, call that Medicaid office. And if that Medicaid worker is busy at that time, leave a message. Leave your number, leave a message, and ask that worker to give you a call back, okay? Because they are there for you as well. But anything we can do as an assister with Healthy Kids Mississippi, we are here for you. Okay, and there's another question. How do I find out who my Medicaid worker is? Okay, the best way to find out who your worker is to what? Call the office, call the Medicaid office. And the Medicaid workers, they have caseloads by alphabet. And so the receptionist can give you that information. Anyone answering the phone at the Medicaid office, they can tell you exactly who your worker is. Okay. Can Medicaid answer questions pertaining to Medicare? Okay, Sister Stigler, Sister Knox, I'm going to let you all answer that for me. Can
They can,
Medicaid?
they
Okay.
can, but mostly they will refer you to the Social Security office, and they only handle Medicare for nursing home and Medicaid for nursing home and places. But when it comes to Medicare,
Right.
you are referred to the Social Security office.
And it's always best to call the Medicare office
Yeah.
if you have a Medicare question, and not call the Medicaid office for questions about Medicare.
Right.
Yes. And you can also go online at www.medicare.gov
That's
and
true.
find contact information there. Okay. And someone just asked if Healthy Kids Mississippi will have, if we have brochures, provide information on exactly what we do, the assistance we provide. And of course, that answer to that question is yes. Actually, we just received a brand new brochures through Healthy Kids Mississippi. We have a trifold, and of course, it has it gives you information on Healthy Kids Mississippi, on Oak Hill Regional Community Development Corporation, our address, the contact information, the fax numbers there, the text numbers there, and of course the websites. We also have information on if you have any questions. There are simple questions as far as, are you in need of health insurance for your children and family? Are you pregnant and in need of medical services? Have you applied for Medicaid and were denied? Have you received a Mississippi Medicaid and it was closed? Have you recently moved to a new address or changed your phone number and unsure if you still have coverage? And have you recently moved to the Mississippi area and need Mississippi Medicaid? We also have a QR code on the brochure. So a QR code on the brochure. So if you have one, you scan it on your phones, and of course you put your information in, and it will come directly to our headquarters, and an assister will be dispatched to you right away. So we definitely have a brochure available, and we definitely want you to get copies of it. So you may want to share with some friends, some relatives, and some of your coworkers. So just contact our office at 662-298-3584, and we'll get those brochures to you in whatever area you in. We have sisters that cover the entire state of Mississippi. We are available. Okay. And of course, Sister Stigler, Sister Knox, Sister Bettina Campbell, and Brother Clarence Campbell, we thank you all so much for joining us on tonight. Again, Sister Finner couldn't be with us, and I was just a little nervous about, doing the Ask Mary and Pat by myself. And you all came to my rescue. I appreciate you so much. And I just want to ask if you have any comments before we close out this week's edition of Ask Mary and Pat.
Ms. Boger, I must commend you. You did a wonderful job. We were here to support you, but you really didn't need us.
Yeah. Thank you
With
so
Sister
much.
Knox, Sister Boger, you did an excellent job. We certainly enjoyed the fact that you asked us.
Thank you so much.
Great job, PT.
Thank you, Brother Campbell.
I echo all that has been said. Never had a doubt in my mind that you would do a wonderful job. But that's what we are all here for. We are a team.
Yes.
Oak Hill Regional Community Development Center, and this is a ministry for us all. And we are dedicated to providing services to people throughout the state of Mississippi. So anytime.
Thank you so much. All right, Duke, it's in your hands.
Thank you. Such an awesome job, such an awesome webinar on tonight. We're glad that we had some special guests to always come in and
Yes.
assist Ms. Boga. They did an amazing job. And Ms. Boga, you do an
Yes.
extremely amazing job each and every month. And next month, we should have Ms. Mary Fenner back with us. So it's be back to how it used to be. But tonight, it was an overall great presentation from our guests. I want to remind everyone that the next Ask Mary and Pet webinar will be October 24th at 6 p.m. Same link and same social media, such as Healthy Kids Mississippi, our Oak Hill Regional CDC page, and our Get Covered Mississippi Facebook page. You may learn more about us at www.oakhillregionalcdc.com and www.healthykidsmississippi.org. You can contact our office at 662-298-3584 or text us at 662-689-9712. Once again, we thank you for joining in. We acknowledge our board chair, Jennifer Garrett, our executive director, Dr. Michael O'Miner, and our project director, Mrs. Lottie Miner. This has been a production of Oak Hill Regional Community Development Corporation, belonging, building, and bridging in the Mid-South region and across the state of Mississippi. Have a great rest of your night, everyone. Until October 24th.